Welcome to the deep dive.
Yeah.
You know how cats have this image, right? Super clean, always grooming.
Totally put together.
Exactly.
Yeah.
So today, we're tackling something that kind of throws a wrench in that.
Yeah.
Excessive drooling.
Yeah.
Hypersalivation, I think is the technical term.
That's one of them, yeah. Ptyalism is another fancy word for it. And it really can be, well, surprising for cat owners.
Right.
We expect sleek and tidy, not damp patches on the sofa. So when you see more drool than usual, it's pretty natural to think, hang on, what's going on here?
Absolutely. So our mission today is to sort of unpack this slightly soggy situation. We'll look at the common culprits beyond the extra slobber, figure out when it's just, normal cat stuff.
And when it's a signal that you really need to get your vet involved.
Precisely. Because it seems like the reasons can be, well, all over the map.
Oh, definitely. It spans everything from a cat being incredibly content and blissed out to some quite serious underlying health problems. Context, as always, is really, really important here.
Okay, let's start with the easier side then. The times when a bit of drool is maybe even kind of sweet. When is it considered normal?
Well, the classic example is peak relaxation mode. When they're purring really loudly, maybe kneading away on your lap.
Making biscuits.
Oh, yeah, making biscuits. Or just totally conked out asleep in a sunbeam. This kind of drooling, it often links back to kittenhood. Think about how kittens knead and nuzzle when they nurse. That behavior, even in adult cats, seems to bring back those feelings of, ultimate comfort and safety.
Makes sense.
And there's a theory this might even trigger endorphins, those feel-good chemicals, which could, in turn, get the saliva flowing. So yeah, happy cat sometimes equals a slightly drooly cat.
That's actually quite endearing, like a little memory lane moment for them. So contentment drool, check. What about food? Does the sight or smell of dinner get them going?
Sometimes, yeah. You might see a little bit, especially if it's something really exciting, like you're opening a can of tuna or their absolute favorite treat. It's kind of like the dog reaction, that mouth-watering anticipation, but usually much, much less dramatic in cats. You're probably not going to see, pools forming when you shake the kibble bag.
Right. No Pavlovian puddles for the average feline.
Okay, now what about the flip side? When they're not feeling great, can stress do it?
Oh, absolutely. Temporary drooling is a definite stress response. Think about car rides.
Oh, the carrier.
Exactly. Vet visits, loud noises like thunderstorms or fireworks. It's usually short-lived in those cases, though.
So not necessarily a huge worry if it stops once they calm down.
Generally, no. If the stressor goes away and the drooling stops, it was likely just a physiological reaction to the fear or anxiety.
Okay, good to know. So a bit with purrs, maybe okay. A bit in the car, understandable. But if it's happening a lot or seems like way more than usual or just pops up suddenly, that's when we need to investigate further, right? That's exactly right. Now we're moving into the territory of potentially abnormal drooling. And honestly, one of the most common places to start looking is inside the mouth itself. Oral and dental problems are huge culprits.
Oh, okay. Makes sense. If your mouth hurts, you might produce more saliva.
You got it. And there's a whole list of things. Periodontal disease, that's gum disease, basically.
Caused by bacteria.
Yeah, plaque and tartar buildup. Then you have gingivitis, which is just the inflamed gums. Stomatitis is even worse. It's like a really intense inflammation that goes deeper into the mouth tissues. Super painful.
Ouch.
Then you've got things like tooth abscesses, ulcers in the mouth, maybe they chipped a tooth, or even just scratched the inside somehow. All that pain and irritation can ramp up saliva production.
And those resorptive lesions you hear about, are they part of this?
Yes, definitely. Those are like cavities that start from the inside of the tooth out, and they can be incredibly painful but hard to spot sometimes. So yeah, the mouth is a prime suspect. Regular dental checkups are just so key.
Wow, okay. So besides the drool itself, what else might you notice if it's a dental issue?
Bad breath halitosis, that's a really common sign. Also, watch how they eat. Are they hesitant? Chewing only on one side.
Dropping food?
Exactly. Dropping food, maybe pawing at their face more than usual. That plaque and tartar buildup we vets always talk about,
Yeah.
That's often ground zero for these kinds of problems.
So keeping their teeth clean isn't just for pleasant close-ups. It actually prevents real discomfort in this drooling issue.
It really does. And just briefly, we should also mention oral tumors, Less common, thankfully, but growths in the mouth, whether they're benign like fibromas or cancerous like squamous cell carcinoma,
Right.
they can cause irritation, pain, or just physically get in the way of swallowing properly, leading to drool.
Okay, that's a more serious possibility to keep in mind.
Okay.
Moving away from the teeth and gums, what else can make a cat drool excessively?
Well, think about things getting stuck in there. Foreign bodies.
Like what? String?
String is a classic, unfortunately, but also small bits of bone, pieces of toys they've chewed up, even plant material like grass-ons can get lodged between teeth or under the tongue.
And that irritation just makes them drool more?
Yep, the body's trying to lubricate and maybe flush out whatever is stuck in there.
Now, I've heard about string.
Hmm.
If you see it hanging out, you shouldn't pull it right.
Absolutely never pull string you see coming from either end of your cat. It could be wrapped around intestines or other internal structures. Pulling could cause devastating damage. That's an immediate vet emergency.
Got it. Okay. No pulling string. What about injuries?
Trauma, yeah. Cuts or punctures inside the mouth. Maybe they chewed on an electrical cord and got a burn.
Oh, no.
Or even injuries from a fight with another cat. Any kind of inflammation or injury in the mouth can trigger drooling. Often with these foreign bodies or traumas, the drooling starts pretty suddenly. That sudden onset is a big clue.
Okay, sudden onset, red flag. Makes sense. So we've got mouth pain, stuff stuck in the mouth. What about feeling sick to their stomach? Nausea.
Yes, nausea is another major trigger for hypersalivation. Think about when you feel really queasy. Sometimes your mouth waters, right?
Yeah, unfortunately.
It's the same reflex in cats. It's like the body is preparing for, well, for vomiting.
And what kinds of things make cats nauseous enough to drool?
Oh, lots of things. It could be relatively simple, like trying to hack up a hairball, or maybe a sudden diet change didn't agree with them, but it can also signal something more serious. Infections, internal parasites, kidney disease is a big one.
Really? Kidney disease causes nausea.
It often does, yeah, because toxins build up in the body.
Yeah.
Also, other GI problems like gastritis, inflammation of the stomach, or pancreatitis.
So if the drooling comes with, say, vomiting, or they just stop eating, think nausea.
That's a very strong possibility, yes. Those accompanying signs are really important pieces of the puzzle.
Okay, now on to something definitely worrying. Toxins and poisons. How do they fit in?
Toxins are a really serious cause. They can work in a few ways. Some things, like certain household cleaners, many common houseplants that are toxic.
Lilies, for example.
Lilies are incredibly toxic to cats, yes. Also, insecticides, antifreeze, even some flea and tick products meant for dogs can be poisonous if put on a cat. These things can directly burn or irritate the mouth and throat.
Ouch.
Others primarily cause intense nausea, leading to drooling that way. And some toxins actually mess with the nervous system and directly stimulate saliva production.
So any suspicion of poisoning?
Immediate vet. Don't wait. Call your vet or an emergency clinic or a poison control hotline right away. Time is critical. Even things you might not think are dangerous can be.
That's crucial advice.
Yeah.
What about prescribed medications? Can they cause it too?
They can. Sometimes it's just because the medicine tastes awful to them, you know?
Oh yeah, pilling a cat can be an adventure.
Exactly. Or the medication itself might have nausea as a known side effect. Either way, more drool. And then there are some less frequent but serious underlying diseases, things like portosystemic shunts.
Okay.
It's basically where blood vessels bypass the liver so toxins don't get filtered out properly. Hypersalivation can be a key sign. And as we mentioned, advanced kidney disease or liver disease often cause nausea, which leads to drooling.
Wow. It really is amazing how one symptom, drooling, can point to so many different potential problems. Okay, what about like neurological things, brain-related stuff?
Yeah, that can happen too. For instance, if a cat has a bad upper respiratory infection, like severe cold.
They get all stuffed up.
Right, and if they can't breathe through their nose easily, they might start breathing through their mouth. That mouth breathing can look like drooling just because saliva isn't being swallowed as efficiently.
Okay, so it's more about the open mouth than excess saliva production, maybe.
In that specific case, yes, but true neurological events can cause it too. Seizures, for example. Cats might drool before, during, or after a seizure. And heat stroke, which is incredibly dangerous, causes heavy panting and drooling as the body desperately tries to cool down.
Heat stroke is definitely an emergency. Any other neurological or sort of other category causes?
Well, we should mention infectious diseases, though they're much rarer in vaccinated cats. Rabies is the classic example, causing drooling and major neurological signs. There's also something called pseudorabies.
Okay.
Also, just general difficulty swallowing the medical term is dysphagia. If a cat can't swallow properly for whatever reason, saliva will just pool and dribble out. And even allergies sometimes can cause enough oral irritation to trigger drooling. And then,
Sometimes you just don't know.
sometimes it's idiopathic. It starts suddenly, you run tests, find nothing, and then it just resolves on its own. Frustrating, but it happens.
The mysteries of medicine. Okay, so if someone listening is noticing their cat is drooling more than usual, what are the key takeaways? What should they be watching for?
Definitely look for those other signs. Is there bad breath? How's their appetite? Any vomiting? Are they lethargic, hiding more, pawing at their mouth? Any change from their normal behavior is potentially significant.
And the bottom line is, don't just watch and wait indefinitely.
Pretty much. Any drooling that is persistent, seems like a lot more than their normal, or starts really suddenly, that warrants a call to your vet. It's always, always better to get it checked out than to wait until something potentially serious gets worse.
Okay, so you go to the vet. What kind of things might they do to figure out the cause?
Well, they'll start with a really good history, asking you lots of questions about when it started, diet, environment, other symptoms. Then a thorough physical exam, focusing especially on checking the entire mouth.
Might need sedation for that.
Sometimes, yeah. To get a really good look right at the back, under the tongue, check all the teeth. Then, depending on what they suspect, they might recommend other tests. Blood work is common to check organ function, look for infection or inflammation. Dental x-rays are often needed.
See below the gum line.
Exactly, for things like abscesses or those resorptive lesions. Maybe an ultrasound if they suspect an internal issue, urine tests, sometimes even biopsies if there's a strange lump or lesion.
Okay, quite range of possibilities.
Yeah.
And what can owners do to help the vet figure it out?
Taking notes beforehand is great. Jot down when you first noticed it, any changes in eating, drinking, litter box habits, energy levels, anything different in the house. Videos can sometimes be helpful too if the drooling is intermittent.
Good idea. And at home, while waiting for the appointment.
You can gently wipe their chin and mouth area with a soft, damp cloth just to keep them comfortable and clean. But definitely don't try to force their mouth open or poke around in there yourself. You could get hurt or make things worse.
Right. Leave the internal inspection to the professionals. So it's clear there's a huge spectrum here, from happy drools to, called the vet drools.
That really sums it up. That occasional little bit of moisture during purr-fests, probably fine. But persistent, heavy, or sudden drooling is your cat signaling that something's up. It needs investigating.
Absolutely. This has been, well, a surprisingly deep dive into cat slobber. Thanks for clarifying so much about this.
My pleasure. It's just about tuning into our cats, isn't it? Noticing those little things that might mean something bigger.
Definitely. And that brings us towards the end of our deep dive today. We absolutely have to remind you, our listeners, that everything we've talked about is for educational insight only. It is not a replacement for professional veterinary care.
Absolutely not. If you have any concerns, any worries at all about your cat's health, including drooling, the only person to consult is your certified veterinarian.
They're the ones who can give you an accurate diagnosis and figure out the right treatment plan for your specific furry friend. Their well-being depends on it.
Couldn't agree more.
So, on that note, we'll leave you with a thought to chew on. Beyond drooling, what other subtle, maybe easily missed changes in your cat's day-to-day habits or just their general vibe might be an early warning sign, prompting you to seek that expert veterinary guidance? Something to think about. Until next time, take care.